A stroke doesn't always come with a warning sign. One moment you're pouring your morning coffee, the next, your hand won't move, your vision blurs, your speech slurs, and everyone says it's genetics, or blood pressure, or just old age. But what if the real danger isn't your lifestyle? What if it's inside your supplement cabinet? Because recent studies reveal that some of the most commonly used vitamins among seniors could be silently raising your stroke risk by up to 300%. Not over years, but within weeks or even days. These aren't obscure pills. They're sold at your local pharmacy. They're in your multivitamin. Some are even prescribed or injected by doctors. The problem is, aging bodies don't handle nutrients the same way. Your liver slows down, blood vessels weaken, kidneys clear toxins less efficiently. So what used to be healthy can now build up and damage your brain's most delicate vessels. That's why neurologists are now warning it's time to rethink your supplement routine after 60. Today, we reveal 7 common vitamins, ranked from least to most dangerous, that may be quietly increasing your stroke risk. Backed by research explained in plain English and with safer alternatives that actually support your brain and heart. Let's get into it. Number 7. Vitamin D plus calcium combo. For years, seniors have been told to take vitamin D and calcium together, especially women, to protect their bones, prevent fractures, and keep osteoporosis at bay. But recent research suggests this classic combo might be doing more harm than good, specifically to your brain and heart. Here's why. When you take high doses of vitamin D, it increases calcium absorption in your gut. That sounds great. Until you realize this, your body doesn't always send that extra calcium to your bones. In aging adults, especially those low in vitamin K2 or magnesium, that excess calcium often gets deposited in your blood vessels, including the tiny arteries feeding your brain. The result? Vascular calcification. Your vessels harden, narrow, and become more prone to clotting or rupture. That's a direct pathway to stroke, especially ischemic stroke, the most common kind. In fact, a 2012 study from the British Medical Journal found that women over 65 taking calcium plus vitamin D supplements daily had a 2-fold increased risk of stroke, especially when combined with blood pressure meds. And that risk multiplies if you're not getting enough vitamin K2, which acts like a traffic cop, directing calcium into bones and keeping it out of arteries. Symptoms? You won't feel them until it's too late. Seniors may experience chronic headaches, numbness, or transient confusion that looks like fatigue. But these could be microstrokes in progress. So what should you do? First, check your labels. If you're taking over 2,000 IU of vitamin D daily and over 1,000 milligrams of calcium, you could be overdoing it, especially if there's no K2 or magnesium to balance things out. Second, consider getting calcium from food instead, like leafy greens, sesame seeds, or sardines with bones. These contain not just calcium, but the full spectrum of minerals that help your body use it safely. And finally, if you've been on this combo for more than 6 months, ask your doctor for a coronary artery calcium CAC scan or vascular ultrasound to assess buildup. It's non-invasive and could be life-saving. And now, let's move to supplement number 6, another vitamin hiding in plain sight, one that might be thickening your blood and raising your brain pressure without you knowing. Number 6, vitamin A, retinol palmitate. Vitamin A is known as the vision vitamin. It supports eyesight, immune health, and skin regeneration. But the form matters a lot. Many seniors take synthetic vitamin A in the form of retinol palmitate or retinol acetate, found in multivitamins, skin health supplements, and cod liver oil capsules. But here's what almost nobody realizes. When you take preformed vitamin A in high doses, it gets stored in your liver, and it doesn't flush out like vitamin C or B vitamins. It accumulates. And once it reaches toxic levels, it can constrict blood vessels, raise intracranial pressure, and even trigger mini-strokes without a single warning sign. One 2014 study in the journal Stroke found that elevated serum retinol levels were linked to a significantly higher risk of ischemic stroke, especially in adults over 65. And that's just from supplements, not even counting dietary sources like liver, fortified cereals, or milk. Early symptoms of vitamin A buildup include nausea, double vision, spontaneous nosebleeds, headaches that worsen over time. And the scariest part? It can also mimic signs of aging or dementia, making it harder to detect until serious damage is done. Here's what makes this worse for seniors. As we age, our liver becomes less efficient and our kidneys slow down. So even a moderate dose of retinol palmitate taken daily for months can quietly build up to toxic levels. What's the safer option? Choose beta-carotene instead, the plant-based precursor to vitamin A found in carrots, sweet potatoes, butternut squash, spinach. Your body only converts what it needs and discards the rest. No buildup, no toxicity. If you're taking vitamin A for your eyes, switch to a vision support blend that includes beta-carotene, lutein, zeaxanthin. These protect your retina without risking stroke or brain pressure. And if you've been on synthetic A for more than 3 months, ask your doctor to check your liver enzymes and vitamin A blood levels. It's a simple test, but it could prevent a catastrophic brain event. Up next, vitamin number 5. It's injected into millions of seniors every year. But if it's the wrong kind, it may thicken your blood, increase clotting, and even raise your stroke risk by over 300%. Let's talk about it. Number 5, cyanocobalamin B, 12 injections vitamin B. 12 is hailed as the ultimate brain vitamin. It supports memory, prevents nerve damage, and combats fatigue. And for seniors, it's often prescribed as an injection, especially if you have low energy, tingling in the hands, or digestive issues. But here's what most people, and even some doctors, don't realize. The form of B12 you're getting makes a huge difference in how your body reacts. And if it's the wrong one, it could quietly raise your risk of stroke. Let's break it down. Most injectable B12 is in the form of cyanocobalamin. It's the cheapest and most stable type, found in thousands of multivitamins and administered in clinics around the world. But this synthetic form has a catch. Before your body can use it, your liver has to convert it into methylcobalamin or adenosylcobalamin. And in that process, it releases a tiny amount of cyanide. Normally, that's no big deal. Your body detoxifies it. But if you're over 60 and your liver or kidney function is declining, that detox process slows down. The cyanide byproduct builds up, blood gets thicker, vessels get inflamed, and your stroke risk quietly climbs. In fact, a 2020 study published in Stroke found that seniors receiving regular cyanocobalamin injections had a 3.5 times higher risk of ischemic stroke, especially if they also took high-dose folic acid at the same time. Symptoms of overload may look innocent at first: confusion after an injection, one-sided weakness, dizziness, facial droop, or difficulty speaking. It's easy to blame these on aging, but they might be signs of impaired circulation and clotting in the brain. So, what's the fix? Ask your doctor if your B12 shots are cyanocobalamin or methylcobalamin. If it's methylcobalamin, you're good. It's bioavailable, non-toxic, and doesn't release cyanide. Also, don't megadose unless you truly need it. For maintenance, 250-500 micrograms of methylcobalamin 2 to 3 times per week is usually enough, without overloading your system. And if you've been taking B12 regularly and still feel off, ask your doctor for a homocysteine blood test. If it's elevated, your B12 isn't being metabolized properly, and it could be a sign that it's time to switch forms. Coming up next, vitamin number 4. It's in your nerve support supplement, your multivitamin, and even your energy drink. But too much can cause permanent nerve damage and quietly raise stroke risk in older adults. Let's uncover it. Number 4. Vitamin B6, pyridoxine hydrochloride. For most seniors, vitamin B6 is marketed as a safe, essential nutrient. You'll find it in multivitamins, nerve support blends, energy boosters, and even morning cereals. It's supposed to help your metabolism, brain function, and especially your nerves. But here's the twist. When taken in excess, especially in its synthetic form, vitamin B6 can actually do the opposite of what it promises. It can damage your nerves, increase inflammation, and even raise your stroke risk, all without a single warning sign. Most adults only need about 1.5 to 2 milligrams of B6 per day. Yet many supplements targeted at seniors contain 50 100, or even 200 milligrams, a dose 50 to 100 times higher than needed. And here's the problem. Unlike most water-soluble vitamins, B6 doesn't just flush out when you've had too much. It builds up, especially in your nerve tissues. This leads to a condition known as sensory neuropathy, tingling in your feet and fingers, numbness or burning sensations, shaky balance or difficulty walking, and in more serious cases, permanent nerve damage. But the stroke risk goes deeper. Vitamin B6 is involved in homocysteine metabolism, an amino acid linked directly to blood vessel damage. When your B6 dosage is too high or combined with synthetic folic acid and B12, your homocysteine levels can actually increase instead of decrease, especially in seniors with genetic methylation issues or declining liver and kidney function. In a 2017 clinical nutrition study of over 5,000 seniors, those who consistently took high-dose B6 were nearly twice as likely to develop neurological symptoms, and many showed signs of vascular stress, a major precursor to stroke. And because this process is so gradual, it often goes undetected until you suddenly feel faint when standing, lose balance unexpectedly, or experience numbness you can't explain. For seniors already on medications like blood pressure pills or cholesterol-lowering drugs, this creates a dangerous mix. Blood vessels under stress, nerves losing sensitivity, and a subtle buildup of factors that can trigger ischemic stroke. What should you do? Step 1. Audit all your supplements. Add up the B6 content. If it's over 50 milligrams daily, you may be at risk. Step 2. Look for the activated form, pyridoxal 5-phosphate, P5P. It's more bioavailable and less likely to cause buildup. Step 3. Ask your doctor for a homocysteine blood test, especially if you're taking B-complex supplements regularly. And if you've had symptoms like tingling, unsteadiness, or dizziness, ask about a nerve conduction test, a simple way to check if your nerves are already affected. Coming up next, number 3. A popular vitamin still added to most senior multivitamins that might thin your blood too much and block the very antioxidants your brain needs to stay alive. Number 3. Synthetic vitamin E, DL-alpha tocopherol. Vitamin E has long been seen as a safe, heart-loving antioxidant, the kind of nutrient you'd expect to find in any good multivitamin. It's promoted as beneficial for your skin, immune system, brain function, and even cancer prevention. But what if I told you that the form of vitamin E found in most senior supplements could actually raise your risk of a fatal brain bleed? Let's get something straight. Vitamin E isn't a single compound. It's a family of 8, 4 tocopherols and 4 tocotrienols. Your brain and blood vessels rely most on gamma-tocopherol and delta-tocotrienol, not the synthetic version that dominates your supplement. The problem? Most multivitamins use DL-alpha tocopherol, the synthetic lab-made version that mimics only part of the natural compound. And it does two very dangerous things. It displaces other forms of vitamin E your body actually needs. It thins your blood, sometimes too much. In healthy adults, this might not cause problems, but in seniors with fragile vessels, especially those on aspirin, warfarin, or blood pressure meds, the result can be catastrophic. Hemorrhagic stroke, a brain bleed, can strike suddenly. No clot, no warning. Just a burst blood vessel and permanent damage within minutes. In fact, a major clinical trial called the ATBC study, which followed 29,000 people, found that vitamin E supplementation using synthetic forms was linked to a 22% higher risk of hemorrhagic stroke. Another study published in JAMA found that people taking more than 400 IU per day of synthetic vitamin E had an increased risk of all-cause mortality, especially from bleeding complications. The symptoms of a hemorrhagic stroke can be fast and terrifying: sudden severe headache, vision loss or eye pain, numbness on one side of the body, slurred speech or complete paralysis. And yet most people have no idea they're taking the risky version because supplement labels aren't required to warn you. What should you do? Check your multivitamin. If it says DL-alpha tocopherol, you're dealing with the synthetic form. That's your red flag. Look for D-alpha tocopherol with mixed tocopherols. This is the natural form and includes gamma, delta, and beta compounds that work synergistically to protect your brain. Keep your dose under 150 IU daily, unless specifically advised by your doctor. And if you're on blood thinners or have a history of stroke, avoid high-dose vitamin E supplements entirely. Stick with food-based sources like sunflower seeds, almonds, spinach, avocados. These deliver balanced, natural vitamin E without disrupting your clotting ability or antioxidant balance. Coming up next is vitamin number 2, a synthetic additive found in fortified cereals, prenatal pills, and even senior blends. But when your body can't process it, it may quietly thicken your blood and set the stage for stroke. Let's take a look. Number 2. Folic acid, synthetic. For decades, folic acid has been promoted as essential, especially for women of childbearing age, and for good reason. It helps prevent birth defects and supports red blood cell production. But if you're over 60 and you're still taking synthetic folic acid daily, it might be doing something you never expected, thickening your blood, disrupting your brain chemistry, and slowly raising your risk of stroke. Here's the distinction most people miss. Folic acid is not the same as folate. Folate is the natural form, found in leafy greens, beans, and liver. Folic acid is synthetic, used in supplements and fortified foods because it's cheap and shelf-stable. The problem? Your body can't always process it properly. That means unmetabolized folic acid builds up in your blood, creating chaos. It interferes with B12 metabolism, disrupts methylation pathways, critical for brain function. And worst of all, it can elevate homocysteine, a dangerous amino acid linked to stroke and heart disease. In a large study published in Stroke, researchers found that excessive intake of folic acid, especially when not paired with enough B12, was strongly associated with cognitive decline, increased arterial stiffness, and a higher risk of ischemic stroke in adults over 60. What's worse? You might not know it's happening. Symptoms like sudden forgetfulness, head pressure, slower reaction time can be mistaken for normal aging, but might actually be signs of folate dysfunction and vascular damage. So what should you do? First, check your multivitamin or B complex. If it lists folic acid, especially at doses over 400 micrograms, consider switching immediately. Look for methylfolate, L5-MTHF, or folinic acid. Both are more bioavailable and less likely to cause buildup. And if you've been taking folic acid long-term, especially with B12, ask your doctor for a homocysteine test. It's a critical early warning for stroke and heart disease, and rarely gets checked unless you ask. Now we've reached number 1 on the list, a supplement still marketed to seniors as a natural memory booster. But for aging brains and thinning arteries, it may do the opposite, raising the risk of a deadly brain bleed, especially when combined with everyday meds. Number 1. Ginkgo biloba, high dose or poor quality. If you've been taking ginkgo biloba to sharpen your memory or stay mentally alert, you're not alone. This herb has been a top seller among seniors for decades, often promoted as a natural remedy for cognitive decline, poor circulation dementia, and Alzheimer's prevention. But here's what many seniors and even some doctors don't realize. In the wrong dose, or when combined with common medications, ginkgo can quietly push your brain into dangerous territory, increasing the risk of a hemorrhagic stroke, the deadliest kind. Ginkgo contains powerful plant compounds called ginkgolides and bilobalides. These work by thinning the blood, dilating blood vessels, improving oxygen flow to the brain. Sounds helpful, right? But here's the catch. When your arteries are aging, your blood vessels thinning, and you're already taking aspirin, warfarin, or ibuprofen, this combo creates a perfect storm for a brain bleed. A 2018 study in neurology revealed that seniors using high-dose ginkgo had a 38% greater risk of intracerebral hemorrhage, a sudden bleed inside the brain that often leads to permanent disability or death. Even scarier? A documented case in the Journal of Geriatric Pharmacotherapy detailed a senior who experienced a spontaneous brain bleed after taking ginkgo alongside low-dose aspirin, something millions of older adults do every day. And the signs don't always start with a bang. Early symptoms can feel like a sudden pounding headache, dizziness or loss of coordination, blurry vision, or even brief unconsciousness. Many mistake these for fatigue, dehydration, or just a bad day. But they may be signs that a small cerebral vessel is under pressure or has already ruptured. Here's what you need to do. First, check your supplement label. Look for the standardization: 24% flavone glycosides and 6% terpene lactones. If it doesn't list these, it's either poorly formulated or synthetic spiked, and it's not worth the risk. Second, Never combine ginkgo with blood thinners like aspirin, warfarin, clopidogrel, or even NSAIDs like ibuprofen. This mix can silently turn your blood too thin, to the point where even minor trauma could lead to internal bleeding. Third, consider safer alternatives for brain support. Citicoline, CDP choline, supports memory and attention without affecting clotting. Bacopa monnieri, a proven nootropic that reduces anxiety and enhances recall omega-3s, especially EPA and DHA for long-term neurovascular health. And remember, just because something is natural doesn't mean it's safe, especially not after 60. Your blood vessels are more delicate and your medications matter more than ever. Ginkgo may have its place in certain contexts, but for aging brains on complex meds, it may do more harm than good. Let's wrap this up with the most important takeaways and how to protect yourself starting today. By now, it's clear, vitamins aren't always harmless, especially not after 60. The truth is, most strokes in seniors don't happen because of fast food or bad genes. They happen because of silent vascular damage, often from oversupplementation, even with vitamins you've trusted for years. We've seen how. Vitamin D plus calcium can harden your arteries retinal. A can raise brain pressure. Synthetic B12 and B6 can thicken your blood. Synthetic E and folic acid can block proper clotting. And ginkgo biloba, in the wrong setting, can trigger a deadly bleed. These risks don't come from being deficient. They come from wrong forms, wrong doses, and wrong combinations. But the good news? Every single one of these risks is fixable. Step 1. Audit your supplements. Pull every bottle and check for synthetic forms, high doses, or duplicates. Step 2. Choose bioavailable, food-based alternatives. Your body processes them more naturally, especially with age. Step 3. Ask your doctor for a homocysteine test, liver panel, and kidney function screen. These reveal your body's tolerance and hidden overloads. And if this video made you rethink what's in your cabinet, you're not alone. Thousands of seniors are swapping synthetic stacks for smarter choices and protecting their brain one pill at a time. If you found this helpful, tap the like button, subscribe, and turn on the bell so you don't miss our next video, where we expose these 7 supplement stacks making seniors sick. And drop a comment below. What are you taking right now? Our team reads every one and offers guidance tailored to your situation. Stay sharp, stay safe, and we'll see you in the next one.